Your kidney is a very important detoxification organ. The renal panel, the blood work, is always telling us a story about your kidneys. What are your numbers telling us? Please allow me to explain. My name is Dr. Ennin, doctorate pharmacist and a functional medicine doctor. And again, welcome to the channel. Kidney disease is on the rise, and common cause of kidney problems is high blood pressure and diabetes by way of chronic consumption of carbohydrate. But today I'm going to be focusing on kidney health with respect to our diet, nutrition, and our lifestyle in the absence of diseases. The focus is going to be on 3 lab markers. And the first one is creatinine, the second one being the BUN or the blood urea nitrogen, and the third one being the estimated glomerular filtration rate, in short eGFR. And the first one is creatinine, and creatinine is simply a breakdown or waste product of our muscle metabolism, and it is excreted by healthy kidneys. And now with the creatinine, we are looking at optimal ranges. We want our numbers to be between 0.7 and 0.9, and these are the numbers we are looking for in the absence of disease. The second one is the blood urea nitrogen or the BUN, and the BUN comes from our dietary protein, and we want the range to be between 10 and 17. So when the BUN is less than 10, then we are going to make some assumptions. Perhaps the person is a vegan and they are not doing a lot of protein, or they have a stomach issue, and for that reason they are unable to digest and absorb the nutrients or the amino acids from protein. And when it's higher, it could mean that perhaps they are overeating a lot of protein or they are on the carnivore diet. So these are some of the things to think about in the absence of diseases. And the next parameter is the GFR, which is really the filtration rate, and it is the rate at which the blood flows through the kidneys, and is a very important clinical marker when it comes to our kidney health. Now, so what is the normal range for the GFR? See, the GFR is pretty standard across many of the labs, and we want to be greater than 60 ml per minute. But this is something for us to think about. Between ages 2 and 25, we want our GFR to be around 125 ml per minute. Now, the normal decline of the GFR is about 1 ml per minute every year. So at the age of 25, if your GFR is around 125 ml per minute, then by age 50, then we expect by normal decline, because GFR declines by age. So by the age of 50, you should have about 25 points yanked off. So by age of 50, you should be around 100 ml per minute by way of GFR. Now, this is something to think about. So in the lab panel, we want you to be greater than 60 ml per minute. So if you are at age 50, you want to have a cushion, and I like to think of that number to be greater than 75. So if you are at age 50, I want to see you around 75 ml per minute, because if you're at age 50 and your GFR is around 62, then very likely that by the time you turn 55 or 60, you have a chronic kidney disease. And these are all things to think about. So when you have the BUN, when you have the creatinine, and you have the GFR, their numbers is always telling us a story. So let's say your creatinine is high, your BUN is high, and your GFR is low. It's telling us a story. It's telling me as a clinician that you may have kidney decline. You are trending down in terms of your kidney function. But if your BUN is high and your creatinine is normal and the GFR is normal, it's telling me that you are probably consuming a lot more protein. You're probably on the carnivore diet. So these numbers are always telling us a story. But you have to be mindful. You have to have an interplay in our mind with respect to what is happening between these 3 numbers. So if you're at age 50, you want your GFR to be greater than 75, because we don't want you to be less than 60. And the normal decline is 1 ml per minute every year. So if you're at age 50, you don't want to be around 62 or 63 or 64. You want to be greater than 75. So you want to have that cushion. So the GFR gives us a better indication with respect to what is happening. I hope this helps. And this is another pearl of health wisdom. If this content resonates, please like, follow, share, and most importantly, subscribe so that we can keep this conversation going. I will see you in the next video. Thank you.